Recording. All right, I am pleased to introduce Dr. Benoît Benoît, an orthopedic surgeon specializing in the evaluation and treatment of hip and knee conditions such as osteoarthritis, labral tears, and meniscal injuries. His practice focuses on providing solutions tailored to each patient, taking into account their conditions, needs, and goals. Osteoarthritis is a common condition that can have a significant impact on pain, mobility, and independence. During this webinar, Dr. Benoît Benoît will discuss with you symptoms, the progression of the disease, available treatments, and management options to help you live better day to day. I hope you enjoyed this webinar. Over to you, Dr. Benoît.
Thank you, Mr. Cierge. So today I have the privilege of speaking with you about something that affects millions of people around the world, which is osteoarthritis. As an orthopedic surgeon, treating patients who suffer from osteoarthritis of the hip and knee is a big part of what I do every day. It's truly at the center of my professional life. So over the next few minutes, here's what we're going to cover. First, I'll briefly introduce myself and the team I work with. Then we'll talk about why osteoarthritis is such an important topic today. After that, we'll define exactly what osteoarthritis is in simple terms. We'll also discuss the symptoms people experience, things like pain, stiffness, swelling, and loss of mobility. Then, most importantly, we'll talk about solutions. What can you do as a patient to reduce pain and stay active? And finally, we'll talk about surgery when it becomes the right time to consider replacing your hip or your knee. So let's begin. Again, my name is Dr. Benoît Benoît. I'm an orthopedic surgeon. My specialty is helping patients who suffer from severe arthritis of the hip and knee, often when their pain has reached a point where it significantly affects their quality of life. My medical training began at Laval University in Quebec City, where I completed medical school. I then completed my orthopedic surgery residency at University of Montreal. And after that, I pursued 2 additional years of fellowship training focused specifically on hip and knee surgery. The first year was in Geneva, and the second one was in Ottawa. I later returned to Montreal, where I worked at Sacré-Cœur Hospital, a teaching hospital for 17 years. During that time, I also had the privilege of teaching and mentoring future orthopedic surgeons. Of course, none of this work happens alone. I'm fortunate to work with an exceptional team. Karine and Danny are our administrative coordinators, and they're often the very first people our patients will speak with. When someone is suddenly dealing with hip or knee pain, they often feel worried, frustrated, or uncertain about what to do next. The first contact matters. Karine and Danny do an outstanding job making patients feel heard, reassured, and supported from day one. We also rely heavily on nursing support before, during, and throughout recovery. Bérangère plays a key role in coordinating patient care, answering questions, and helping patients feel supported throughout their journey. So why are we talking about osteoarthritis today? The answer is simple. Osteoarthritis is one of the most common chronic medical conditions in adults. In fact, more than 1 in 7 Canadians is affected by osteoarthritis. And after the age of 50, it's one of the leading causes of chronic pain and loss of mobility. The good news is that today we have many effective ways to help people stay active, reduce pain, and continue living a full and healthy life. And that's exactly what we're going to talk about today. So what's exactly osteoarthritis? The easiest way to understand what is osteoarthritis is by looking at the joint. Here on the bottom right, you have a picture showing 2 knees. The knee is made of the thigh bone, which is the femur, and the shin bone, which is the tibia, and both articulate together. Where these bones meet, exactly about here, they're covered with cartilage. Cartilage will act as a cushion. It allows the bones to glide smoothly against each other and without pain. In a healthy joint or a knee, all of this cartilage is intact, but in osteoarthritis, that cartilage gradually wears away. And this is what we see here because in between the femur and the tibia, there's nothing left. So both bones are touching each other. That creates inflammation, stiffness, pain, and eventually loss of function. And osteoarthritis doesn't only affect the knees, it also commonly affects the hips. In the hip, we have a ball and socket joint. As you can see here on the bottom left, you have the ball of the femur here that will go inside the socket in the pelvis. When the cartilage wears out, bone starts rubbing on bone, and that becomes extremely painful. Now, why do some people develop osteoarthritis while others don't? There are several risk factors. Age is one of them. The older we live, the more wear and tear our joints experience. Genetics always, I will say, also plays a major role. Just like eye color, cartilage quality can run in families. Body weight is another important factor because extra weight will increase stress on the joint. And finally, previous injuries, repetitive physical work, or certain sports can also accelerate joint wear. So now, what are the clinical or warning signs? Usually, the first symptom is pain during activity. At first, the pain often improves with rest. At first, it will improve with rest, as I said, but then it's going to become permanent. Then people will start noticing stiffness, especially in the morning or after sitting for a long period of time. Some notice swelling, especially in the knee. Others will hear clicking, grinding, cracking sounds in the joint. And as arthritis progresses, walking becomes more and more difficult, mobility will decrease, and daily activities become harder. So now the question becomes, how can we relieve pain in patients living with osteoarthritis? We, as surgeons and doctors, always like to start with the simplest solutions first. And one of the simplest and most natural solutions is cold therapy. If a joint becomes warm, swollen, or painful after activity, applying ice on it can be very effective. This is not something new. It's been used for generations, and we still use it every day in hospitals and surgical centers after many types of surgery. So if you're at home and you have mild, moderate, or even severe arthritis, and your knee or hip hurts after being active, don't underestimate something as simple as ice. Take an ice pack, apply it directly to the painful joint, and let the inflammation calm down. Another important tool is pain medication. In general, we try to stay away from narcotic pain medication whenever possible because these medications can lead to dependency. Osteoarthritis is a chronic degenerative condition. It does not simply go away, so we want safe long-term solutions. That's why we usually start with medication like Tylenol or anti-inflammatory drugs like Advil or Robaxacet. And if those are not enough, your physician may prescribe a stronger anti-inflammatory medication such as naproxen. Now, one treatment that is often underestimated is physical therapy. Many people believe that when arthritis hurts, they should stop moving. In reality, the opposite is true. You don't need to move less, you need to move better. A physical therapist can guide you through exercises designed to maintain muscle strength and mass, preserve joint mobility, and reduce stress on the joint. This can make a huge difference. Another very effective treatment option is joint injections. There are mainly three types. The first one is probably the best known, cortisone injections. Cortisone is a powerful anti-inflammatory medication that can be injected directly into your joint. It often works well, especially in patients with mild to moderate arthritis. Many people worry about side effects from cortisone shots. In reality, side effects from occasional joint injections are quite uncommon. Cortisone tends to cause more side effects when taken by mouth every day over a long period of time, not when it's injected in the knee or another joint once in a while. The second type of injection is called viscosupplementation. These injections are designed to improve lubrication inside the joint and help protect the cartilage that remains. They can be very effective in selected patients, especially at earlier stage of arthritis. However, when arthritis becomes very advanced, the effect may be more limited. And more recently, another option has become increasingly popular, platelet-rich plasma or PRP. With PRP, we simply take a small sample of your own blood, isolate the platelets, which contain growth factors, and inject them back into your joint to help reduce inflammation and potentially support tissue healing. And finally, when all conservative treatments are no longer effective, we move to the final option, which is surgery. And that, of course, is my specialty. Hip replacement and knee replacement surgery become appropriate when pain continues despite medication, physical therapy, injections, and when arthritis starts significantly affecting your quality of life. At that point, we do not simply tell patients to live with the pain. We can offer a surgical solution that, over a period of recovery, can allow them to return to an active and fulfilling life. One message I always emphasize is this: avoid prolonged rest. When you have arthritis, staying completely inactive is not the answer. Movement is medicine. So, what should you do as a patient when your joint pain begins? I would say the first step is to get a consultation with your doctor. You can certainly try Tylenol, ice, or even see a physical therapist if you like, but only a physician can make a correct diagnosis. And without a diagnosis, any treatment is simply guesswork. Medicine always starts with diagnosis first. Then once we understand what's causing your pain, we can choose the right treatment. If the arthritis is advanced, or if the hip or the knee is severely damaged, then it may be the time to consult an orthopedic surgeon like me. Our role is first to confirm the diagnosis, evaluate the severity, review the previous treatments, and determine whether surgery should be considered. Now let's talk about my favorite part of the presentation, joint replacement surgery. When we perform a knee replacement surgery, we remove the worn-out surfaces and replace them with metal and high-performance implant components. Instead of bone rubbing against bone, the implant becomes the new smooth surface of movement. The same principle applies to hip replacement. We replace the damaged joint with artificial components designed to restore smooth movement and eliminate bone-on-bone pain. And the good news is that modern implants have become extremely durable. Today, hip and knee replacements often last more than 20 years and sometimes much longer. 20 years ago, younger patients were often told to wait before having surgery, but today, implant technology has improved so much that many patients in their 40s, 50s, or 60s may keep their implant for the rest of their lives. That allows us, surgeons, to help patients much earlier when pain becomes life-limiting. Recovery after knee replacement is usually a little longer than after hip replacement surgery, mainly because there tends to be more inflammation and stiffness after surgery. But with proper rehab, most patients will return to their normal activities within a few months. Preparation before surgery is also very important. The stronger and more mobile you are before your surgery, the easier your recovery tends to be. That's why we encourage patients to stay active, maintain muscle tone and mass, and lose weight when possible before surgery. Simple home modifications like a raised toilet seat can also make the first few days easier on you. Most patients will stay in the hospital for 1 or 2 days after their surgery. Some younger or healthier patients may even go home the same day. After surgery, physical therapy becomes not only an option, but essential. Walking with a cane or a walker will be encouraged in the first few days and weeks. And when everything goes well, the vast majority of patients achieve excellent outcomes. So if you're living with osteoarthritis today, what can you do to live as well as possible? I would say, first of all, try to move a little bit every day. Move smart. Go for a walk, bicycling, swimming. Choose activities that are kind to your joints. Eat well, reduce sugar, increase healthy fat like omega-3s, which are found in fish. Maintain a healthy body weight. Sleep well, manage your stress, because the truth is, osteoarthritis is something you can live with if it is properly managed. So, in conclusion, understanding your arthritis is really the first step toward taking control of it. And that journey always begins with a proper medical evaluation. Thank you. So, Mr. Tivierge, I don't know if you want to move ahead with the question.
Yes, thank you very much, Dr. Benoit, for this insightful presentation. So it's now the time for the Q&A session. And as a reminder, you are invited to ask your questions right now via the chat feature, accessible via the chat button on Zoom. And you can also raise your hand using the reactions option at the bottom of your screen. So do we have question now? Maybe no. Everything is clear?
I guess so.
All right. Bon, so,
Oh,
vas-y, do you want to take care of
sorry,
this?
I'm gonna sneeze here.
Okay. While she's during that time, Ginette Dubé asked, "Do you recommend taking glucosamine subs?"
Yeah, well, supplements of glucosamine are popular because there's a lot of publicities about it everywhere we look at television, radio stations. So, but the fact is that it's not proven more efficient than the placebo. So, if you have money to spend on something, I strongly suggest you don't do it on glucosamine. For some patients, it may work because of the placebo effect, but there's no strong surgical
Evidence.
review that recommend glucosamine.
Okay. Any other questions? All right. So, thank you very much, Dr. Benoit, for this presentation,
It was my pleasure.
which has taught us a great deal about the prevention and the reasons and the treatment of osteoarthritis, and to Mrs. Poulin, who coordinated this session with me and read one question. And as a reminder, after the video conference, we will send you an evaluation and questionnaire, the PowerPoint presentation, and a link to the recording.